So when we see wrist pain, there's oftentimes a lot of causes. Um, some of the things I see are when patients come in and they're trying to hold things and they're gripping, they have pain in their actual thumb joint right through here. I also see people with masses on the top of their hands, such as this. Can you talk to me about those things?
Sure. There's a couple reasons why you would have swelling on the back of the wrist. One of the worst causes of it is a chronic ligament tear and a condition called a slack wrist. That is usually a presentation where people have endured discomfort for many, many years, right?
Hard workers.
Hard workers. Usually a history of a trauma, but often one that isn't remembered. And they just can't take the pain anymore. And that always presents with swelling in this area. And often people have had surgery in the past for what another doctor may have thought was a ganglion cyst, and it is not. Um, a ganglion cyst is swelling on the back of the wrist, or sometimes on the palmar surface of the wrist. We call it the volar surface. And it's a fluid leakage out of a tendon sheath, the sleeve of a tendon, or out of a joint. And it collects in a separate area, typically under the skin, and it's soft and it can be moved around sometimes, but it's always very soft, or at least can get soft and hard intermittently.
Sure.
And that's a fluid-filled cyst, and
Right.
and that can be treated non-surgically most of the time as well. In fact, most things can be treated non-surgically. Um, Alternatively, if the pain is at the base of the thumb, it's almost always thumb arthritis. The most common arthritic pattern that requires treatment is arthritis at the base of the thumb, where the metacarpal bone touches the carpal bone, and we call that CMC joint, or carpal metacarpal joint osteoarthritis, which is wear and tear arthritis.
Isn't that one also an inflammatory process from the rubbing that goes on?
It can, and that's what the swelling is called. So there's, yeah, when two bones rub against each other in an abnormal way, the cartilage is worn off. There's an inflammatory reaction, and the balloon around the joint or the joint capsule collects extra fluid. And that's often the major source of pain. It may not be the bone rubbing against bone, but the swelling occurs. Usually, the worst pains in our body is when we take one of God's cavities and stretch it. And that's true for the thumb joint as well.
Right. How do we treat that?
For thumb arthritis,
Sure.
always non-surgically first. When people come to us with advanced arthritis, they've already proven they can tolerate pain, and we don't often have to hit a home run with surgery. If we can get a double or a triple without surgery and get them back to where they were 5 years earlier when they were tolerating their arthritis,
Right.
that's a very, very satisfactory outcome. And that's done by special splinting that we mold in the office here so it fits them and only them.
Right.
It's infinitely better than the one size fits none splint you can get at a local drugstore or on the Amazon. Um, and custom made splints truly work wonderfully. As I said, infinitely better. So if you're not getting result with a splint you buy yourself, it doesn't mean a splint won't work. And then an injection of steroids into this area. And then lastly, we always try to avoid prolonged oral medications.
Right.
It's usually an older population. People my age should not be taking an anti-inflammatory pill like ibuprofen every day.
Absolutely.
Their stomach lining can get hurt. You can have bleeding ulcers. Almost 20,000 Americans die every year from ibuprofen-like medicines with bleeding ulcers. I mean, probably hundreds of thousands of more have bleeding and don't know about it.
Sure.
Or they do find out about it and it gets treated successfully, but a lot of people die from it. So we try to avoid those. It also causes kidney problems. But if you take that class of medicines and you make a compounded medicine out of it, meaning that it's made by a pharmacy, and there's a wonderful pharmacy in Rocky Mount that does this, and you can get that medicine, rub it on the skin, and it penetrates the skin, and it gives you decent results without surgery and with decreasing or maybe eliminating the need for injections.
So that's a topical anti-inflammatory.
It is. And so a splint, a topical rub-on cream anti-inflammatory, and the occasional injection. Most of our patients grow old with us never needing surgery.
Right. Absolutely.
Sometimes surgery is necessary, though. If none of the surgical or non-surgical treatments work, one of the most pleasing surgeries we do for somebody is to replace this joint. It's extraordinarily successful for hip and knee replacements, equally as successful and just as pleasing for thumb joint replacements.
Absolutely. So if you're having thumb pain, wrist pain, have abnormalities of your wrist that you're concerned about, we at Carolina Regional will be glad to take a look and help you out.